Good morning, everybody. Welcome to Alternative Ways, August 23rd in service. I hope you guys are all doing well out there. I can't wait to start seeing your faces again. As you know, we are still all doing remote, and actually that's going to continue until probably the end of September. We're crossing our fingers with the new guidelines that are going to be coming out, and hopefully the numbers of COVID will start going down a little bit, so that we can kind of get back to whatever normal is going to be. So today I have the pleasure of presenting to you guys a couple different things. First of all, I'm going to be talking about emergency procedures, lost client, those kinds of things. So I am going to be reading some of this because I don't have all this memorized. So this information that I am going over with you can be found in your handbooks that were given to you during orientation. If you have any questions and you want a copy of it, please let me know and we can definitely shoot one out to you. So I want to talk to you about if you're working with a client and they become injured. First of all, you all should be carrying your emergency kits in your vehicles. You should have first aid kits, should have your thermometers, maybe some gloves, mask, all the essentials that you need. So if you don't have one of those, make sure you talk to your program managers, or your case managers, and they can hook you up with one. So if a client gets injured, you're going to do a lot of assessing. Y'all all have your CPR and first aid, so you know the basic kind of stuff and what to do. You want to assess the injury. If first aid can be administered, you want to proceed with the first aid. If the injury requires EMS, you need to call 911 right away. When in doubt, call. That's always the rule. If a client's in need of CPR, again, you want to begin administering CPR and then have somebody else call 911. You want to make sure you stay on the line with 911 so they can give you whatever instructions that they need you to follow. If the client is taken by EMS, you need to make sure you accompany the client to the hospital. With COVID, they probably won't let you go back in the room, but you can at least give the information to the hospital that they may need. All of you guys have access to their app, so you know all the information about this client, you know his meds, you know his diagnosis. So make sure that you are familiar with how to pull that stuff up off your phones in their app in case you need to get that information. And then obviously during this time, you'll be speaking with your case manager or TNR program manager here at the office so that we can make sure we're following up on whatever we need to. So that's an injured client. If a client gets lost, we haven't had too much of an issue with this in the past. However, we now have a whole bunch of social recreation people out there, and it can happen. So in the event you are not able to locate your client, you want to follow the following protocol. You want to call the primary contact person as soon as you notice the client is not where he or she is supposed to be. Your primary contact person would be Frank. He would be for social rec. It would be your case managers for ILS. You want to be prepared to give them the following information: where and when they were last seen, identify what the consumer was wearing, where you have searched, what staff and other clients are present. You need to identify any bus information or program information associated with the client, what the nearby places are, and that's the information you need to give to your case manager or to Frank. So your primary contact person, us here in the office, will organize community search, remain available for incoming calls, and facilitate information between staff and searchers. So we need to make sure that, again, that you have access to your phones and that you know how to pull that emergency information up so that we're able to notify whoever we need to notify. Your guys' responsibility in the field, though, is to gather as much information as you can to be able to relay that information to your case managers, and they'll be doing the organization of the search and notifying whoever we need to notify. And then obviously we have to do an SIR, Special Incident Report, to Regional Center. Diabetic emergencies. I've done this in service many times. Diabetics do have diabetic emergencies. One of the main emergencies are hypoglycemia. I want to just touch base with that a little bit. When I did the last in-service for Social Rec, my Zoom cut it off, so I really didn't get to the very end of it. So I thought, well, everybody could probably use a refresher course. So again, I'm going to read this just so I make sure I get everything correct and what I want you guys to know out there. So hypoglycemia. Let's see where we are at. That's obviously means somebody is diabetic. Hypoglycemia means that there is a low blood sugar. Some of the early warning signs of hypoglycemia are confusion, dizziness, nausea, feeling hungry, shaking, nervous, irritable, anxious, sweating, chills. They can become pale. They can have really clammy skin. They can have a rapid heartbeat, weakness, tiredness, tingling in the mouth area, headaches, a seizure, coma or loss of consciousness, and they can also have weight loss if their hypoglycemia persists. So as you can see, there's a whole bunch of signs and symptoms that may appear and may not appear if a client has hypoglycemia. What you want to do is you want to make sure that the person gets a high carb snack, carb sugar, right? Sugar. So some clients carry a glucose tablet or a glucose stick with them in their purses or pockets. You need to know that, especially social rec people. We've given you social rec people a cheat sheet so you know who's diabetic and who isn't. So obviously, before any of you take on a new client, even if you're just running them back and forth to pick up a medication or go to the doctor, you need to know that client. You need to pull them up in therapy. You need to take a look at who they are, what their medical history is, so that if something like this happens, you know, okay, if they're sweating profusely and they're shaky, it's like, oh crap, okay, well, I remember reading he's a diabetic. He's probably has hypoglycemia. So what you're going to do is either the glucose tablet, if they have them, give them some kind of a sweet juice like apple juice, a candy, a sugar lump. I don't even know if they make sugar lumps anymore, but that's what it says. So you want to make sure that they're getting some sugar. The ADA, which is the American Diabetes Association, recommends that you wait 15 minutes before testing your blood sugar. If they're still low, take more. Take more. But if you have a client that's had these serious things, it's probably a 911 call if you've never worked with that client before. If you're not able to give them some sugar and their sugar come up, then that's an emergency situation. The clients that we have are very capable, most of them, of telling you exactly what's going on with them. They can tell you, hey, my blood sugar's low, I need to get some of this, I need to get a coffee or something with sugar to pop up my blood sugar. If the person is conscious and unable to eat, someone who's with them should put a little honey or something else sweet and put it inside their cheek. That way they'll get the sugar also. If they start to lose consciousness, you just call 911 immediately. That's just bottom line. So that's hypoglycemia. If you have any questions about that, again, I can send this information out to you. If you want to physically have something in your binder, that's not a problem. Let your case manager know. The next thing I'm going to talk about for emergency procedures is seizure protocol. So again, social rec people, check your cheat sheets, find out who has seizures. You need to know that, because when that person hits the ground and starts flailing, you need to know, gee, this person has a seizure disorder. Or if it's their very first seizure and they've never had a seizure before, it's an immediate 911 call. So you need to know your clients before you pick them up. Before they even come in your car, you need to know what information about them. So Where am I at? Seizures do not usually require emergency medical attention. You usually only call 911 if one or more of the following that I'm going to go over are true. The person's never had a seizure before. That's an immediate 911 call. The person has difficulty breathing or waking after the seizure. The seizure lasts more than 3 minutes. That is alternative ways seizure protocol, 3 minutes. Anything over 3 minutes, it's a 911 call, unless the client that you're serving has their own particular seizure protocol that their doctor has signed off on and it's in their book. You will know that. If you don't know that, ask. Some clients have a seizure protocol that say wait 5 minutes before you call 911. Some clients have a seizure protocol that says if this client starts seizing, call 911 immediately because of maybe something that's happened in the past. So you need to know what your client's seizure protocol is. You need to know if the client has seizures, right? Okay, so if the person is hurt during the seizure, if they fall, if they bonk their head and now they're bleeding out of their head, that would be a 911 call. They fall, their arm gets caught behind them, there's an obvious fracture, or their leg is broken from the fall, that's a 911 call. If the seizure happens in water, if they're out there swimming and they have a seizure, you need to call 911. If the person has a health condition, heart condition, or pregnant, you need to know that per their protocol. And then you always defer to the physician's order on file. So if they have a seizure protocol that's signed by the doctor, you need to know that and you need to follow that. So those are the emergency procedures. Quick overview. Again, if you don't get any of that, if you need more in-depth training, let me know. I can bring you in and we can talk a little bit more about it. The next thing I want to cover is paid family leave. This again is part of your handbook. Paid family leave, I'm going to read it because I want you guys to know exactly what it says. An employee covered by state disability insurance may receive up to 8 weeks of benefits over a 12-month period for any of the following items. Number 1, if you have to care for a serious illness, let me back up. If you have to care for a serious ill child, spouse, parent, grandparent, grandchild, or sibling, parent-in-law, or domestic partner. That has to be a serious illness. It can't be because they have the flu, okay? If you are going to bond with your new child or the new child of your spouse or domestic partner. If you're going to bond with a child in connection with the adoption or foster parent placement of the child with you or your spouse or registered domestic partner. If you're planning on participating in certain qualifying related to active duty or call to active duty of the individual spouse, domestic partner, child, or parent in the armed forces of the United States. There are qualifying exigencies, they say. They are limited. The best thing you can do is to call the paid family leave department. We have that number here in the office and it is in your handbook. So if you want to know any information, don't ask us. This is a government thing. The government pays you, not us. We just have to follow the guidelines that say, okay, she has a ill child and she's going to be out 4 weeks through paid family leave. That's all we have to know. They pay you, you're off the schedule. When all that's done and over, you come back to work. So if you want more information about that, look in your handbook under page 24, or you can call us and I'll give you the phone number that you can call. All right, that's that. The last thing's COVID. Tired of COVID. So looks like the end of September, there's going to be some new guidelines that are going to be coming out. So for now, we're not even going to discuss those yet because we don't want to confuse you guys. We are status quo. Mask, health checks, check their temperature. If a client says they're sick, you don't put them in the car with you. You pick up the phone and call your case managers. So same, mask, gloves, all the same protocols that we've been doing for the last 6 months. So continue doing that. And if you'll hang tight, I'll get Tina, who's going to be covering a couple other things with you. And I hope you all have a wonderful day. Take care. Be safe out there.
Hello and welcome to August 2022 in service. I'm going to be going over a few things today with you guys regarding our HR manual, which we do every year. I'll be talking about phone calls in your cell phones and photos. With your cell phone, we know that they have a lot of, you have Instagram, you have Facebook, Snapchat and stuff. So we need to make sure that we do not post anything of our clients on any kind of social media. With Social Rec, I know a lot of our individuals in the ILS program are in Social Rec. So if you're taking pictures out there during Social Rec, those pictures need to only be sent to Frank and deleted afterwards. You shouldn't be sharing those pictures on any kind of social media at all. So just be mindful of that, so we can protect our clients' rights and make sure all pictures are only sent to Frank. And sometimes they might be sent to me, but that's an exception. So, but just make sure, please do not post any of our clients on any social media. Smoking. Knowing alternative ways is a smoke-free workplace. So be mindful. If you are a smoker, make sure that your car, is smoke-free of, the scent. And I know it kind of lingers and stays within, in the seats and stuff. So make sure you disinfect your cars, use a spray if you're transporting clients. Dress code. I know it's hot out here in Fresno, and it's going to continue for a while. So just be mindful of what you are wearing while you're out working out in the field with our individuals. Cindy's rule is no butts, no belly, no boobs showing. So just be mindful of how you dress while you're out representing alternative ways. Charting has been an ongoing issue. As I'm in office, I am auditing files. I'm going over the binders, the reports and everything, and I see that there's a lot of missing charting out. And it's very important that we have our charting in place so that our case managers can have the report sent to CVRC in a timely manner. So please make sure that charting is in. The charting does have to match your time card. I'm auditing those chartings. I'm looking over if they're up in the time cards. So if I see that there is charting out, I will be holding checks, meaning your checks I will stop direct deposit and your checks will be mailed out on payday. Another thing with that, if you're having a problem with charting, you are always welcome to schedule a time in the office and sit on one of our computers to, put your charting in if it's, becoming an issue with late charting or a lot of charting out. So you could contact me via my phone or email and schedule a time to come in, and we would let you use one of our computers to get all your charting in. Calendars at the client's homes. This is for ILS, SLS, and Social Rec has their own calendars that Frank puts out the week prior to the upcoming month of events. So the calendars in the ILS homes, all clients should have some sort of calendar either on their wall a desk calendar or in their phone of upcoming appointments, the grocery shopping. They should have a scheduled calendar with all ILS staff. So please make sure that your clients are have calendars and are saving, that on their phone as well. That's something that you could help and teach and train them in putting their appointments in their phone with an alarm set, so that they're aware that they do have upcoming appointments. The calendars, if they don't have a calendar, the dollar store has very nice calendars there that you could help purchase, take the client to purchase. And I think that's all I have for this in-service. If you have any questions, feel free to call me, email me. Like I said, we're still going through a lot with the COVID. There's a lot of COVID cases coming in and out of the company with staff and the clients. So just be mindful, with all the protocols in place, making sure that you are washing your hands, you're sanitizing your cars, you're wearing a mask, and you're taking your client's temperature. You guys should be also, if you have a medical appointment with a client, making sure you call them that day before and give them a reminder, and do a screening and make sure that they're feeling well if they don't have any of the COVID symptoms, because we should not be transporting clients if they have any of the symptoms. So we're trying to protect, all our staff and make sure that, the clients get whatever help they need. If you're in need of any mask or hand sanitizer or disinfectant wipes, please contact me as well to schedule a time to come in and get those supplies. Okay, thank you. You guys have a great one. Bye.